to be talking about the top 3 ways to help with neck pain and headaches. Hi, I'm Dr. Freddie So, and welcome to this week's episode of Dr. Freddie Said So. You know, neck pain is one of the most common issues that people ask me about in my clinic. With today's environment of computers and phones, we're seeing a preponderance of people having these kind of issues. And instead of turning towards drugs and painkillers, anti-inflammatories, which we all know don't fix the cause of the problem and also can cause tremendous side effects now and down the road, there's natural solutions that you can even start implementing today to help prevent and resolve some of those issues. One of the major causes of headaches and neck problems comes from the position of your head. We all know what poor posture could look like, but a lot of people don't see it on themselves. Your ears should line up directly over your shoulder. Your head is about the weight of a bowling ball. It's about 12 pounds. So try holding a 10-pin bowling ball here to here. Well, I'm sure you can imagine how much harder it is out here. So that 12-pound bowling ball is now going to be 20, 30, 40, 50 pounds of pressure being put on the muscles here in my neck, but also, more importantly, on the nerves that are inside the spine. And when this forward head posture occurs, it puts tremendous pressure called subluxation, damaging the nerves. So yes, that's obviously going to result in things like headaches. Some people get headaches behind their eyes, in the back of their head. Neck pain and shoulder pain, even mid-back and lower back issues can stem from this forward head posture. So one of the best ways to help this is obviously be aware. Your ear, remember, should line up over your shoulder. So if your head is forward, then obviously the best way is to help bring your head back. So just try this. Take your chin, tuck it back. For most of us, we need to go backwards, and you'll hold it for about 5 to 10 seconds. A lot of you will feel some tension in the back of your neck as you do that. Again, the idea is to help over time retrain the muscles of the body to help hold that position. Now, another stretch can be very effective is also neck extension. Now, I caution because this stretch might not be applicable to everybody, but the most important thing for most people is to create a proper C-shaped curve in the neck. So the spine should be shaped like a banana, this way. For a lot of us, when we've seen patients' x-rays, they think they have good posture, but their x-ray is showing a curve that's lost that natural curve. It's too straight, or sometimes we've seen a higher percentage of people where their neck is actually bent backwards. And that puts extreme pressure on the nerves in the neck and the spinal cord. So one way for these type of people we need to do is to bring your head towards the ceiling. Now some of you might not be able to go as far as me, you might only be able to go this far. But the idea is we need to get our eyes looking higher, and in doing so, again, hold it for about 5 to 10 seconds, and that will help. Also, extend the neck, create some stretching of the muscles in the front of the neck, and help, again, restore some of that posture. And lastly, and not least importantly, is rotation. Because we know basic living involves moving our neck, whether you're driving your car or you're looking around at work on a computer screen. A lot of us have limited rotation. And so one of the best ways to work with that is just to bring your chin towards your shoulder as far as you can. Ideally, you'd be right to your shoulder, about 90 degrees, and then do it the other way. Again, 5 to 10 seconds each side. You know what, if you're stopped at a red light, or you're waiting on the GO train, or you're having some problems, you know, even in the middle of the day at work, try those 3 stretches, and those are ways that can help you alleviate some of that stress during the day. Now I caution, these stretches are not necessarily applicable to everybody. The only way to know is really to get a professional checkup by a doctor of chiropractic that specializes with corrective care, maybe even take an x-ray to see what your spinal curvatures look like. That's what we do with our patients all the time. So thanks for enjoying this video. If you can like it, share it, comment with any questions you have, even let us know what other health topics or concerns you'd be interested in learning more about. Again, your family's wellness starts here. I'm Dr. Freddie So. Have a great, well-adjusted day.